Right. Oh,
Yes.
so,
Oh, I thought it would be formal, but
oh, okay.
with your outfit, I know that it will be relaxing, right?
Yeah. Are you at home or are you like working?
Yes, yes, I'm at home. Actually, this is my brunch time. Yes,
Oh, wow. Okay.
yes.
Am I disturbing you?
Sorry.
Am I disturbing you?
Oh
Like,
no, not at all, not at all, not at all. It's a perfect time. Uh,
uh,
actually,
and
yeah,
you cook or you kind of go your order or how?
I try to cook, but
Uh,
what very funny is, let me show
uh,
you something. Today I
okay, sure.
try to cook my
Uh,
first my first croissant
wow.
The- from the
First
scratch,
croissant.
from the
Oh,
scratch, and it's look like this.
hey, it's
It's
not bad. Oh, it's
no,
pretty good.
I think it's the it's look okay, but
Right.
here the consistency. I think it's the worst one.
Well,
Yeah,
I said at least it's still edible and trains your gums and stuff. Eh? Yeah.
maybe. But my kids refuse to eat it, so I have to
Oh.
prepare something else. Yes.
Oh, normally that's all Paul saying love. And normally do you guys cook or do you order food or how does that happen?
Yes. Actually, I'm trying to cook as much as I can.
I
Okay.
see.
In the
I see.
past, before everything happened, yes,
Right.
I try to cook around once a week or twice a week around
Okay.
that because
Right.
I'm quite busy, but not
Right.
as busy as you, by the way.
No.
But yes, during this time, I try to cook a lot because I try
I
to make good things for my family, my twin
I
kids, and also my
I
wife. Yes.
and currently are you guys in a lockdown? You guys in the lockdown, right?
Yes, definitely. Yes. Now we
Okay.
are in the
And
lockdown.
how long have we been under lockdown right now?
Okay. From actually in Bangkok, they stopped the operation of the aesthetic clinic
Right.
for 2 or 3 weeks already around that.
Okay.
Yes.
About the same time, right? About the same
Yes, it's
time. Right.
almost the same time as
Right.
Malaysia, I guess.
Right. Fantastic. And what have you been doing like during these past few weeks?
Oh, okay. So actually, I work for the hospital too. So I
Right.
still go to work at the hospital, but
Right.
because I have to do the all the kind of the dermatologic problems, which is the
And you're
new
seeing
one.
mostly right, mostly cancers, mostly all the more essential ones.
Yes, yes, yes. Now we are focusing on more emergency one or the
Right. Right.
disease that need to cure. We do recommend that for something that can wait, such as aesthetic. We
Right.
try to do it in virtual. Yes,
Right.
glad that my hospital they are very good in making the virtual hospital. Yes,
Okay.
we do the follow up and we do the um, evaluation of the patient by virtual
I see.
IP things. Yes,
That's CBT vet hospital, right? Is it
yes,
CBT vet hospital? Okay. And then mostly you do a lot of virtual consultation.
yes, yes,
And I see
definitely.
a lot of people coming because of COVID-19. Do you have like skin vasculitis or skin eruptions due to COVID-19? Do they send to you? Do they go to you?
Personally, myself, I have experienced only some fever with rash, but I have sent to the internist and also sent to the
Okay.
pediatrician. But
Right.
some of my colleague who is in the center of infectious disease
Right.
in Bangkok, they have starting to found the drug reaction. Yes,
I
because
see.
in COVID patient, we are
Right.
tending to use many kind of antiviral and also other kind of
Okay.
medication. Yes, so
So
the
it's
problem
more
of
drug erection. So it's more drug erection rather than the viral eczema or viral
yes,
eruptions. Yeah. I
yes.
see.
Now, as I asked the experience of the colleague who is dealing with COVID a lot.
I see. And
Yes,
you went to school in Chulalongkorn University,
yes,
and then
definitely.
you did your dermatology
In
in
Sinakarin Road, yes, in
right, right,
Thailand, yes, and I do
and
the
and
anti-aging.
I see, and anti-aging as well. And you also is a celebrity in Thailand. You
Oh,
came out with your album when you were a medical student, right?
actually, in my after the intern,
Ah, I see.
yes,
Okay.
yes, after the
All
intern,
right.
yes. In medical school, I have a chance to be a TV commercial model.
Oh, okay.
Embarrassed to say that. It's
No,
funny
no.
to say that I'm a model or something like that, but
Uh,
yes, yes, I used
yeah,
to work like that, but I choose medical career. Yes, I choose
right,
medical
right.
career. It's my
And
life. Yeah.
but yeah, and how did it happen? And how do you divide your time? Because I still see you do a lot of commercials. You
Mm.
sing, right?
Mhm.
You and your wife sang for a Thai drama before, right?
Oh, I wish you didn't mention about that, but yes.
Right, right.
Yes,
And,
yes, I have some. So about time, I think it's about the time management, right? Yes,
right,
I'm really, I'm really admired about the the fact about the time management. I
right,
always keep up with it, and I always read or listen to podcasts about this. Always, I learning a lot of things about this. I think the key is the prioritization.
okay,
You have to know what you are facing now. Which one is
right,
urgent? Which one is urgent but not important? Which
right,
one is urgent and important?
right,
Which one is not urgent but important? And the
right.
last one is not urgent and not important. Yes,
Good. Okay,
you have to divide it into four parts and
right.
then you manage it. Yes, this is the
See,
way
that's
that I
that's a
deal with
good
it.
tip. And how
Thank
do
you.
you? Which one do you attend to mostly? Important and urgent, and then what's your second one?
I think
The urgent
it's
or not so
different.
important, or the important but not so urgent.
Yes, actually, what is important but not so urgent is very important
Okay,
because maybe it's something that you need to do it every day.
right.
And if you do it routinely, you will be prevent it to be urgent and important.
All
Yes,
right.
that one
That's a very
if you live your life correctly, I guess you don't
right.
have that much. Yes, you don't have to urgent and rushing in everything. Yes,
Fantastic. I think that's a
yes,
good tip, right?
this is my
And
key.
currently you have your hospital and you also have your private practice, right?
Yes, I have three private practice places.
Three.
Two,
Okay.
yes, three, yes. Uh, it's a small one, not the big one as Click. But
No.
I have two skin and laser, and another
Right.
one as a managing director. I have a plastic
That's
surgery center. Yes, I work with my colleague who is the specialist
uh,
in plastic surgery.
the Dr. G clinic, right? The
Dr. G,
plastic surgery.
yes, yes.
Yeah,
He
yeah.
is my friend. Yes, yes. He's very
I
good.
see, I see. So
Yes,
you are help. So basically, you are he's doing most of the plastic surgery,
yes,
and you
yes.
are just trying to manage it from your point of view.
Manage. Yes,
Ah, that's very
everything.
nice.
Mhm.
And two of your private practice. So basically, are they in the same area or they are far apart? And how do you divide your time between these three and also your university,
Okay.
your hospital?
Hospital, right? Okay. Actually, it's quite not that far apart, but it's different. Okay.
Right,
One branch is in a very inner city. It's in the Sukhumvit Road. Another branch is more in the residential area, which
right.
is near my house. Okay,
Okay,
so I think the feeling is different. The patient is different group.
right.
So that's why I try to open it separately. Yeah.
Uh, but do you
I,
go? Yeah, do you go there
yeah.
every day, or how do you divide the time between these three places?
All right.
Four places.
It's quite hectic, a little bit hectic, but I try to make sure that even though I work how many places, I will make
Right.
time to send my kids to school. So I'm a
Oh wow.
morning person, yes, and
Uh,
I have an evening with them more than
right.
one time a week, and also
Okay.
a free day, yes. So
I
sometimes
see.
I have to go many places in one
Right.
day. It's
Wow.
maybe a little bit hard, especially in Bangkok with all the traffics like this.
Traffic.
So,
Yeah, that's crazy.
but Yes, I try my best to keep it like this. Yes.
So you send your kids to school in the morning.
Yes, every day.
Do you walk there or do you drive there?
Oh, drive. Sure, drive. In
Okay.
Bangkok, you cannot walk
Yeah,
much.
well,
Yes. It's not
and then
friendly to
after
walking. Yeah.
yeah, and then after that you go to the hospital every day, or the hospital is just a few days in a week,
Oh, okay. For my hospital, actually, I will attend it around 2 or 3 days.
right?
Yes. 2 days for anti-aging and another 1 day for dermatology.
I see.
Yes.
And then for your private practice, do you go every day or do you split them
Actually,
as well?
actually now it's almost because my second brand is just open. So I need
Alright.
to, keep it up a little bit. Yes. And I
Okay.
try to create my team. Actually
Right.
now I'm having fi 6 dermatologists to work
Oh,
with.
okay.
Yes, and 2 ophthalmologists
Wow.
and 3 plastic surgeon.
Wow. You
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 know
are
that.
you, you are bigger than Click now.
Actually, they're all my friends, so it's quite easy. But as we are a doctor, we know that in each specialty they are different, right?
Yeah, yeah,
Dealing with pediatrician, dealing with the ophthalmologist, and dealing with the surgeon is different. So I think it's
exactly.
fun. It's fun for me. I love people. I love working with people. Yes.
Oh wow, that's one of the things that is not easy to do. I mean, managing people and dealing with people, I think that's one of the
Hmm.
things that we always find difficult. And I think you are managing it very well. That's fantastic. Do you have people helping you in terms of management?
Oh, a lot. Yes. I have to
Uh,
say that teamwork is the most important things.
yeah,
I'm
you
I'm
must
so
have a
lucky.
yeah. You think
Yeah.
yeah, you must have a big team with you. How many people are in there in the whole team?
Yes. And the whole team is 40. Yes.
Okay, right.
Not include the medical. Yes.
I
It's
see. I see.
40.
Okay.
Yes.
Wow.
Yes.
Wow.
And
That's
actually,
right.
I'm a very lucky person because I have my sister who
Uh-huh.
is a tax specialist.
Oh, okay.
So she can help me a
That's
lot
good.
with that.
Yeah. Yeah. You
Yes.
need a finance person in there as
Yes,
well.
definitely, definitely. Yes, and
And
also
how?
my wife helped me a lot. Yes.
Oh, okay, that's good. And then she's a celebrity. She's a famous celebrity in Thailand, right? And I've told that her show a lot of people watch because she's very
Yes,
funny
yes.
and very engaging.
Mhm.
Yeah. And how? And you have two little kids who are super cute. So
Thank you.
yeah. So
I show only the good side. Yes, in the social media. I keep the monkey side with me. Yes.
and they have been doing some of they are celebrities themselves as well, right? They have been on commercials
Oh,
and been like
I
a
don't think
lot
I
of
cannot. I
things.
don't think I cannot say that. I'm trying to keep them out of the
Okay,
show business a little bit, but maybe it's involving without any attention. Yes, sometimes
right.
with
Mm.
the
Why is
commercial
that?
things a little bit. Yep.
Do you want to protect their childhood a little bit more, or do you do
Yes,
it because okay, right,
I think human is human. We need the normal environment to grow up, right? I'm not believing in fame and money
right,
since you are
right,
young. It's my
right,
duty to
right.
raise them, not their duty.
Right.
Yes, is to make business. Yes.
But when you go out, right? Because so many people know you guys, and then when you go for holidays and stuff, do you get harassed? Like people say, "Oh, I know this too." Do you get that?
A little bit, yes, but
Okay.
I'm quite straightforward about it. Yes, I
Okay.
will tell them directly, especially if I'm with my kids. I say that
Right.
they are too sorry, they are too young. Just that.
Uh,
I think
right.
90% they will understand.
I
Yes,
see.
because yes. To be
And
straightforward, yes.
right. And how is the situation in Bangkok right now? In Thailand itself, is it under control?
Um, Uh, I think we are getting better, but I cannot say that we are under control. Yes,
Right.
from the statistic, yesterday is dropped down into
Right.
new cases. Yesterday we found is around 50 cases. 50
Right.
cases, which is quite a good number now because it's
It
less than
is.
100 that we are trying so hard. But
Yeah.
I cannot say that we will lower down our guard. Yes, we
Yeah.
are. we are still doing it because actually too bad that in the basic Thailand's got not much doctors and healthcare personnel, especially comparing to other country. Actually,
Right,
our doctor, we have got only around zero point 0.5 per 1,000 patients in our
right,
country, right? Comparing to Malaysia, we are lacking, twice
right,
from your country. Yes, so
right.
we are really, really concerned about this, that we have to protect because if it's uncontrollable or something like that, we will face big problems. Yes,
Right,
we are
right.
trying our best.
And Thailand has been doing a great job. You see the numbers, you have 2,000 plus,
Mhm.
we have 5,000 plus. Your death
Mhm.
rate is about, you have 35 deceased, we have
Mhm.
more than 70. We just hit 73 today.
Okay.
And of course, most are recovering. But I think Thailand is
Mhm.
doing a good job in that. And but
Thank
it's
you.
a lot
Thank you.
of people are doing screening. Is
Mhm.
screening and contact tracing doing very well in Thailand? Do you think?
Yes, uh, I have to start with I have to start with the recognizing of the disease from the people, the awareness. Yes, you
Right,
can see that because I think at the start, maybe Thailand is really close to China, and we are a
right,
tourism country. So
exactly.
yes, we are quite have information about it. So at the
Right,
very first stage, we quite have an awareness about
right,
how to do the protection and how to prevent the disease. As you can see that you during the RCD meeting that
right.
you are entering, that
Yeah,
everybody will wear a mask and do everything, right?
exactly,
Which we
exactly.
were a little bit surprised for other foreigner speakers. But I
Yes,
think we start a little bit early because we aware that we have a lot of Chinese tourists. That is
right.
the spot that is the start of the COVID, right? So,
Yeah,
but after that, I have to say that we don't have that much test because our policy is to do the test only on the PUI group,
right,
right?
right,
But now we are open more and we are trying to do the test more.
right.
But anyway, I think we still keep up with the good caring of the people because the death rate and the illness is not
Yeah,
showing up much.
appreciate. And then because you guys went through SARS before, right? During the SARS period, did you
Uh-huh.
guys have a lot of cases during that time?
I think not much. Yes, not
Okay.
much. Yes, yes.
And, but
Yeah,
the awareness is pretty good. And you
yes,
have been doing some awareness campaign as well, right? You've been doing some
definitely.
things,
Always,
saying, talking about it. I think that's great work.
always.
Great work.
Actually, in the term of healthcare, I have to admire my colleague who is in the epidemiology department. We have quite a strong team of the
Right.
epidemiology, yes, in
Fantastic.
Thailand.
And during that time, you already started having your face shield.
Oh,
Like,
yes. I
so are you
always do
using?
it.
Yes,
You know
yes.
what?
You,
Yes, I
mm,
always do it. Yes.
yes. And how do you like it? Because
Mhm.
yeah, from now on, I think you are pretty visionary. You started doing that pretty early, and I
Yes, yes,
think
yes.
after this, a lot of people will have to use face shield because you still
Mhm.
have to protect your eyes,
Yes,
protect your
yes.
and it's not as difficult. It's not as like because when you wear your mask too long or you wear your goggles too long,
Mhm.
it's actually pretty hard to do a lot of things.
Yes,
Yeah.
yes.
But do
I
you
think
always find the fogging a problem when you
no.
talk? You know?
I think if you wear a mask and you wear a face shield, it will
Uh,
help a little bit. I think yes,
okay. So
and you
you have
get
a
used
double
to
effect.
it. Yes, you
Okay.
get used to it. And for my practice, I always believe in the word universal precaution
Right.
because
Right.
I would think that I think in my experience, I used to catch a flu from my
Right.
aesthetic patient. I'm quite
Oh.
sure. Yes, during that
Okay.
time. After that, yes, I try to wear this. But I think everyone will face a problem that you may look strange to your colleague, right?
Right.
Everyone is teasing me that, oh, you have expensive face. You need to protect your face or something like that. But I don't care. I keep doing
Right.
this. Yes, and I
That's
think it
good
helps a lot. I think it helps a
because
lot.
it will be in fashion very soon. I think every
Yes,
practice from right after this COVID-19 will be doing the same thing.
yes,
And
I think
and
we
you're
have to change. I have a plan already to change something in my practice
right,
after if we can reopen after the COVID. We have
right,
to do many things that
right.
to make sure that not only ourselves but also our patient to make it more safety, yes, in the
Yeah.
term of
And
the
what are the
tourism.
plans? Would you want to share with us what are the plans that you're gonna do?
Oh, definitely. Actually, for myself and my team, we have discussed for a long time, and also I just have a live session. I've just watched the live session like this with Dr. Vorapong and Dr.
Okay.
Rangsima, which is a very best of your friend too, right?
Right.
Yes, you can ask him. Yes,
Right.
if we have a live session with
Yeah,
him.
I'm doing one with him this Tuesday, this coming
Yes,
Tuesday.
wow, it will be great opportunity because he is a
Right.
very academic guy and also a mentor for me. He's really updated and he review every papers about how
Right.
we can prevent the spreading in our clinic.
Right.
Yes, we can divide it into three factors, like
Right.
medical personnel and
Mhm.
also the patient's field and also the environment of our practice.
Right.
Yes, the first is for ourselves.
Right.
He really in details about what we should wear.
Right.
Yes. Now, when I practice dermatology, especially when I do procedure, I wear a goggle,
Right.
and also the face mask.
Right.
Usually, I will use the surgical mask in daily life, but for higher risk
Right.
procedure, like the procedure with the foam, like CO2 laser
Yes.
or
So yeah.
erbium laser fractional, and also the bleeding one, like some
Okay.
kind of injection or
Right.
some procedure that you need a long time, like
Yeah.
Altera or Thermage. Yes, you need
Yeah.
to wear maybe something more like N95 or something
Okay.
like that. Yes,
Right.
and always I will wear my
Safe. Wow.
old friend, my old friend, the face shield. I always wear that.
Wow,
Okay.
you are very protected.
I always like that.
So
Yes, I
really,
always
yeah,
like that.
that's very good. Yeah.
Yes,
And
and I also, yeah, and I
yeah, you say
also try to make this as an example for our staff too, especially the staff which they are not having training in medical field before, like
right,
therapists. Yes,
right.
they need knowledge to deal with it. They don't know
Yeah,
the sterile technique. Sometimes they training in another uh,
yeah,
aesthetic things. Yes, but I have to teach them, and
yeah.
at least they have to have a face mask and also the face shield and also their hair. In no
Right. The
time for showing your hair, no matter how expensive you do the color, it's time to cover it with the cap. Yes,
okay.
yes, I
And do
try
you
to
wear
make
gown?
that.
Do you promote doing gowns, or do you actually sort of put on gowns or somewhat
Yes,
of
yes.
effective gowns?
Actually, in my private practice, if I can reopen it, usually in my practice I wear the surgical
Scrub.
scrub. Yes,
Yeah.
yes, and also wearing a gown
Okay.
above. Yes, because
All
I
right.
have little kids. So after
Uh,
I yes go back from work, I will change before I go home. Yes,
got it.
and I will
That's,
directly go to the shower and wash my hair every day. Yes, this is
yeah.
what I do. Yes, and
Okay.
also I think I need to change a lot of props and interior in my clinic because
Right.
usually I make it look like home. It's a really
Right.
homey clinic. So there are
Right.
many decoration that is, cannot wash. It's not washable. Yes,
Right.
so maybe I have to make it more minimalized now.
Yeah. Yeah.
Yes, I have to be aware in the
Exactly.
details like that.
Exactly. Imagine they look at the books, they turn it, you,
Yes,
and then there's another person come in and touch it, and
yes,
then
yes,
rub it,
yes.
and that's it.
I
Yeah.
think that
So
they will change always. Yes.
yeah, and yeah, I think Ramsimas came in as well. And so we know that in Thailand, you depend a lot in tourism, especially, and
Yes,
now with the whole
definitely.
lockdown, and
Mm-hmm.
tourists is not be they are not able to go to Thailand, and
Mm-hmm.
I mean, it definitely the whole tourism is gonna get a big hit. Does
Mm-hmm.
it affect a lot of people, especially those who actually depend on tourism to survive?
Mhm.
And is there any aid from the government that helps them? Because these are the group that's get most impact of this, right?
Definitely. As we know that the tourism and also the traveling and transportation is the first business that will run down after the situation like this. Okay. And yes, I have to admit that Thailand, a lot of our GDP come from the tourism. And I think that there needs a lot of help. Yes, there are no adaptation because it's different from other kind of the situation. It's not like
Right.
economics collapse or anything else, but it's the disease, which is a good way that we need to stop. So
Exactly.
it's not time to think about reopen it or trying to promote or anything, but it's
Definitely.
about helping each other to get through this situation
Yeah.
together. Okay. Personally, I always believe that I'm so blessed. I'm so privileged to have a house and also to make a self guarantee in a very decent way. I'm more than thankful for my life already. But unfortunately, Thailand is still facing an inequality
Right.
problems, which
Right.
I think all over the world we have this
It
problem
is.
about
It's everywhere.
inequality,
Yeah.
right? So personally, I truly believe in giving with the
Right.
CSR, but
Right.
I really concerned about the way that we give.
Right.
Actually, in Thailand, it's like our nature that we are a giver. Yes,
Right.
if you come to Thailand, you will know that we are quite a, in nature we are quite a generous person.
Yeah.
But I
Exactly.
think what we have to concern more is how to give and make
Right.
the most effective way. Mhm.
Right.
Now I joined two main program
Uh-huh.
for the CSR. The first
Right.
one is called COVID Bangkok. Yes,
Okay.
COVID Relief Bangkok, which they are
Right.
really a professional in CSR doing. They
Okay.
are social enterprise. They used to be the the program that distribute the food for the poor. Yes,
Okay.
24 hours, 7 days in the past.
Wow. Okay.
Nowadays, yes, nowadays I think they know how to manage with
Okay.
with which area is needed and also what kind of things they are needed.
I
So
see.
if you're interested, you can check out on the Facebook. It's called COVID Relief Bangkok. Yes, this
Okay.
one
Oh,
is a really
Bangkok.
professional one. Yes,
Okay.
as uh, actually, today in this afternoon, I will give them the around a ton of rice and also water and also
Right.
the alcohol gel that I try to make it more gentle for the skin and
Sure.
give to
Sure.
them. No selling. Yes, only
Yeah.
give away. Yes,
I see.
and yes, in another part, because as you know that I graduated my medical school from Chulalongkorn,
Right.
so. Yes, I have to thankful for the Thai Red Cross Society, which is
Okay.
very close related to the Chulalongkorn
I see.
Hospital. Okay, so
Right.
I also doing the program called MedASA, MEDASA, which
Right.
is the program from the Thai Red Cross Society that
Right.
will try to spread the face shield, yes,
Yeah.
to
I
our
think I saw.
medical profession.
I saw
Yes.
that on your. And you're distributing to all hospitals or clinics as well. How
Yes.
does it work?
Okay. Actually, we use the AI to do the data. Yes.
Okay.
We have the center in Chulalongkorn Hospital, but because Thai Red Cross Society, they have a group in every province of Thailand, and
Okay.
they have the data a lot, and we use AI as an
Right.
application. It's
Right.
even can recognize that which area is lacking or something,
I
and also
see.
if you register in that, it's even choose the CSR things that what
Hmm.
is suitable for you. Yes, so
Got it.
it's
Oh,
a
okay.
good things
That's
of the
very smart.
information technology. Yes.
Yeah, that's very smart. Do you
Yes.
have cases like people holding face mask or lack of face mask in any hospitals? Was this something that's happening in Thailand?
I think it's always happened like in everywhere in this world. Yes,
Yeah,
because now it's like the demand of it is shooting up like this, so it's really
exactly.
impossible to manufacture to get everyone to get it enough right away. But
Right.
I think the good thing is Thailand is quite a mixing country that we have many kind of the factory, and I know
Right.
that a lot of my friends they adapting their production line into
Right.
something that we need, like a
Oh.
facial mask. Yes, yes, and also in a big company also trying to launch more. So
Right.
after this, I think the supply will be better. But the distribution will be the thing that we have to concern. Yes, so I
Right.
join something like this, like MedAsa from the Red Cross Society, that which
Nice.
I believe that they can guarantee the distribution to be fair.
That's good. That's good. And these days, besides staying home, how often are you going back to the hospital? 3 times a week, or
Yes,
you're
I still work as the same, but
okay?
maybe it changed a little bit in my practice because yes, usually I am in the anti-aging department, so
Right.
I think during this time it's not a good time for do anti-aging. Yes,
Right.
so I'm doing more on the health promoting and also do virtual hospital and
I see.
educate a lot of my patients. Yes, and for
That's
skin is
good.
more on the disease side. Yes, not much on
Right.
the aesthetic side. Yes, and also promoting the
Yeah.
healthcare
The
things.
health and everything. But your private practice is all closed, right? You're not going to
All
your private.
closed. Now
Okay.
it's all closed. Yes, yes.
Right.
I'm trying to give as much as I can to my staff. Yes,
Right.
holding 40 staff is not a little deal. It's a big deal.
Yeah.
Yes,
The
it's
big deal.
quite a
I think
big
it
deal.
affects
Yes,
all of us, right?
yes.
Especially
I'm trying hard.
closing down for a month now, and then we'll
Yes,
close for another 2 weeks.
yes,
And
yes,
I think we're still paying our staff
yes,
regularly, and
yes,
that's one thing that we really
yes.
have to count as well.
I still do
Uh,
it. Yes, I still
uh,
pay them. Yes, I
uh,
still try to make the best for them. Yeah.
True.
It's like
And
family. Yeah.
yeah, and how long do you think this lockdown will be? Like, is there a date that the government sort of tell you that well, after this time we probably will loosen up a little bit, or currently you don't have any idea at all?
Yes, I think no one can tell exactly, right?
Right.
But I have to update you the situation here. I think the authorities
Right.
of the government for open
Right.
up which business or which is not is depending on the province. Yes, yes, and
Okay.
yes, in some province of
Right.
Thailand, they open it. They have a
Oh,
plan to open already in
I see.
16. Yes, but I think we have to wait. Yes, and personally, I think we can wait. Yes, any
Right.
long, I can wait. Yes, I think
Right.
I can still, hold it on. Yes, and
Right.
caring of my staff, I can do it for the country. Yes, I can
You're
do
doing well.
it. Yep.
And do you have more time to exercise or do a lot of things that you want to do?
Ah, yes, actually, this is one of a big change in my life. You know that actually I'm quite a gym rat, right? I
Yeah,
do,
yeah. I can
in the
see
past, I
you
do
are.
it every other day. Yes, I do it every other day. Yes, but
And
now today, I focusing more on functional training. In
wow,
the
okay.
first stage, yes, yes.
Uh,
Good luck that I buy a lot of equipment at home.
ah,
Actually, actually, you can check out in my Instagram.
right.
Yes, I buy it one by one for a long time, but
I
it's
saw
really,
some of it that you were
yeah,
doing together with your 2 kids.
yes, yes, yes. It's fun. It's like
Right,
a really family golden time, and
right,
I think it really works. Yes, if you're
right.
focusing on keep it leaner and make it more functional. And I found out that I feel much stronger because the
Nice.
complexity of the movement is
I see.
more than you just doing the weight. Yes, so
Good, good.
now, yes, yes, I have to
Yeah,
be strong to passing through this and also
right.
keep up with everything and also
Uh,
help
you're doing
help
very well.
others. Yes, I'm trying my best. Yeah.
You're doing very well. Yeah. So, like the whole thing, once it's gone, I think our practice will change. I mean, you
Yes.
already did a lot of good work there, and
Thank you.
but look into our industry stuff, and what do you see? Like any big changes to come, or do you have any perspective that this whole thing will change after the
Mhm.
COVID-19?
I think definitely. I think our practice need to be uh, more on the universal precaution,
Yeah,
right?
more
Because
vigilant. Yeah,
in every steps of our practice,
right,
I think in the past maybe we are lacking of it, right? Because
right,
sometimes
exactly.
it's more on the beauty side than the medical side. But personally, I really respect aesthetic science because I think it's one kind of the disease. I never look down at my career because it's a demand of the human and we have to
Right,
take care of it in the
right,
right way,
exactly,
with our knowledge and every practice of our uh, dedicated ourselves to do this. Okay, so
exactly.
I think in the future maybe we will be more serious in the safety of our patient and also our staff. Yes,
Yeah,
there will be some more investment with the disinfection and also the sterile technique. Yes, I even have a plan to have a UV robot or something like that in my
right,
clinic. Yes, I
right.
think that will helps a lot. But thank you that I think when we have a problem, it's good thing that we also have the technology that can keep up
Exactly.
and to deal with
We,
it, right?
we learn
Yes,
from all this
yes, we
that
learn a lot. Yes, we
yeah,
learn fast in the medical field. Think in a good way that it's warning us to keep us on ground and also stick us to the knowledge and fundamental things and make it
exactly,
right. Yes.
exactly. And I think maybe nature is teaching us a lesson. And
Mhm.
one good thing is before this, there's been SARS, MERS, there's
Right.
been and all the coronavirus before this,
Hmm.
and our
Hmm.
flu that
Hmm.
taught us some protective ways like all this physical distancing. Or else, I think if China and Hong Kong hasn't been through SARS, I think the situation in China and Hong Kong on this part of the world be so badly affected, just
Hmm.
like what's happening in Europe and USA right now, right?
Yes,
And
yes.
I think from now on, we probably have to take that as a lesson to move on and be more
Yes,
vigilant
yes.
because of that.
Yes, yes,
Yeah,
yes. I think it's a
yeah,
big lesson, and we also have to keep in mind that we are, if you have a house, and if you still can feed your family and yourself well, you have to keep in mind that you are really privileged. There are much, much more
exactly.
people out there that
Suffering.
they're lacking of everything. They're lacking of
Exactly.
knowledge, they're lacking of supplies and everything. It's about our world and society. So please,
Yeah.
please,
And I
please
think,
do
think we
something.
have moved too fast into capitalism that now this disparity between the rich and the poor has become so wide, so big.
Yes,
I
yes.
think this will
It's
probably
sad.
put a microscope into this situation as well as in
Hmm.
terms of how the society needs to change a little
Yes.
bit to be able to make everybody survive in the years to
Yes.
come. Yeah, yeah.
Hmm.
So,
Hmm.
well, so great to see you and have you
Thank
here
you
to
so
talk
much.
about it. And we have so much discussion. I really
Hmm.
like the idea about the UV. I think that is something that we also want to look into. I just saw one article saying that they are doing the handles with
Oh,
the
yes,
UV
yes.
light. Yeah, yeah, that's pretty awesome. And yeah,
Yes, yes. I
yeah,
think there are many new things, but we have to be aware, right? Because you
right,
will see always,
yeah.
burning our skin too. So use it with careful
Exactly,
practice. Yes.
and trying to do a lot of things. And I think
Hmm.
that's something that we look into the new
Hmm.
world the new normal that
Hmm.
we'll see in the months and
Yes.
years to come. All right. Thank you so much. It's great to see you.
Oh,
I'm
thank
so
you so
glad you
much.
got here.
Before I
And
go, I have to say that since you are almost Thai, you know
right.
what? Tomorrow is a Thai New Year. It's Songkran.
Uh,
Yes, so we are
so,
really good luck that actually today is like a New Year's Eve for
oh
Thai,
wow,
right? Yeah,
wow.
so we are
Right.
in the
So,
big festival. So
exactly.
wish
So
you a happy New Year.
Happy New Year. Happy New Year to
Happy
you.
New
Happy
Year.
Songkran. Yeah.
Yes,
So
happy
are you going
Songkran.
to wash yourself like with water or like
Yes.
Learning from Vorapong, are you doing that?
I think yes, it in my house, of course, because
Okay,
we are
okay.
during the social distancing time. So
All
I think
right.
it's maybe the first time of Thailand because usually it's a very big water festival. Yes, for my
Exactly.
international friend, you can search it. We have a really big party usually during this time, but to this year, yes, it's different. We
Right.
may do it online. Yes, we
Yeah.
we even have the water play online, and also
Uh,
we can do it
the
our house.
virtual
The
fasting.
virtual splashing. Yes, yes. Then maybe we can do that. All
All
right.
right. Happy Songkran, Happy New Year,
Thank
and
you
stay
so much.
safe. Hopefully,
Thank you so
once
much.
this is all after, we'll get to meet again. And like you
Thank you.
say, that time probably all of us are wearing a face shield. Maybe we'll get
Yes.
some from you too.
Thank
All
you
right,
so
good
much.
luck.
It's really
And
honor. Yes.
the pleasure is ours. Yeah, okay. All right,
Yes.
see you then.
Thank
Okay,
you,
bye
Ting
bye.
Song. Thank you. Bye
Thank
bye.
you.
สวัสดี
Okay,
ครับ
bye. Bye. Wake up.